Hi, my name is Kimberly, and I will be presenting research I found on the inequities in healthcare in America. So, we know that healthcare is necessary to live a long and quality life. However, 25 million Americans do not have access to it, most of who are racial and ethnic minorities. This prompted me to ask the research question, what social factors influence the inequities in healthcare experienced by racial and ethnic minorities? I found that the social factors that exacerbate this issue include level of income, socioeconomic segregation, and bias in the healthcare system. I will also focus on healthcare coverage and health professional and patient interaction. Level of income. Having financial difficulties, such as in poverty, restricts people to reside in low income neighborhoods. Most of these people are minorities. According to Schreider, the poverty ratio in 2022 for Blacks was 1.5 versus the 0.8 for whites. Their low income means they cannot afford health insurance. Research by Williams and Mohammed suggests that these restrictions to access adequate health care cause minorities who earn income below the poverty line to have severe health issues, as they are 30% less likely to access this care at all. Healthcare coverage. In the US healthcare system, healthcare access is closely linked to work, and most employees have employer-sponsored insurance, which is basically when the employers provide healthcare coverage to their employees. However, many low-income minority workers receive very little to no healthcare assistance from insurance or their employers. This is because they earn too much to qualify for insurance programs, such as Medicaid, but not enough to pay for medical services. This brings me into my next point that fewer low status workers are eligible for employer sponsored insurance, or they're less likely to receive it. This is because it depends on their job position and in what industry they work in. According to Lee, minorities, particularly Latinx and Blacks, are less likely to receive this insurance because they tend to work part-time in agriculture, construction, and building maintenance. In 2018, only 31% of low-income Latinx workers in California actually received employer-sponsored insurance. The CDC estimated that this makes about 1 in 3 employees unable to visit a doctor, increasing the risk for health issues. Minorities are also at greater risk for injuries and infections since they tend to work in the frontline jobs. The nature of these jobs are physically demanding and often overcrowded. Over time, this hinders their work performance and can reduce their income. Socioeconomic segregation. According to Schultz, segregated and low socioeconomic minorities experience higher rates of infection from exposure to viruses in their communities with crowded living conditions and working conditions. Also, they do not have the reliable means of sanitation due to disparities in their hygiene and water resources. This increases their risk for health issues significantly. According to 2022 study by Wolf, 5.8 million people in segregated communities delay seeking immediate medical care because of transportation barriers. However, the available transportation is often unrealistic as it costs them a lot of time and money. The only option left is to receive medical care from safety net hospitals that are actually in their communities. But safety net hospitals cannot regularly provide the adequate medical care to patients because they're not given enough financial support to maintain quality resources and staff. In other words, minorities are left with the options of either not receiving care at all or receiving inadequate medical care. Health professional and patient interaction, which branches off of bias in the healthcare system. Several biological and lifestyle biases clinicians have about minorities cause miscommunication between the clinician and patient. For example, the common assumption that Blacks have a different biology than whites, such as lower pain perceptions, thicker skin, or that they practice less healthy lifestyles. This cognitive framing bias prevents patient-centered communication and trust when clinicians make inaccurate decisions based on misjudgments, and the risk for miscommunication becomes very high. Because there's none of that critical, complex decision making, it contributes to misdiagnoses and improper treatments given. As a result, the patient's health issues advance, or they may even develop new health issues from the inappropriate treatment plans. So, to wrap it up, what and how do social factors influence the inequities of healthcare? First, poverty and income disparities restrict minorities' access to regular healthcare because they cannot afford it. Also, because minorities make up most of low status workers, they become ineligible for insurance assistance but are not provided with adequate health care from their employers. Second, the inability to practice hygiene and decrepit living conditions in segregated communities makes them more susceptible to infections. And these infections are unlikely to be treated given transportation challenges and under-resourced hospitals. And third, with biases present throughout the healthcare services and process, minority patients are more likely to not be understood by clinicians, nor have their symptoms addressed, compared to white patients. As a result, their health issues advance. Clearly, minorities are essentially left to figure out their health issues on their own. They become more at risk for health issues and have their health decline more than whites. This is significant because these healthcare inequities and more go against the principles of social justice and limit a person's chances to live longer and healthier lives. And thank you for listening.